Secondly, it's always struck me that from the occasions when I've watched in simulation centres and watched activities, that the behaviour patterns that you observe, particularly when you've got people coming from a single hospital or a single unit, the behaviours you observe in simulation can tell us a great deal about what the culture's like where these people are working, how they interact with each other, what kind of behaviours the leaders use, how people respond to that. When you create situations around error, what happens? But is that information that you witness in your sim centres ever fed back to the hospitals, the clinics, the units? I don't mean data on an individual, that wouldn't be ethical, but these patterns of behaviours you see over and over again, where does that go? Because if it doesn't go back to the organisation, it means that you don't have an effective safety management system. And I think there's probably masses of data in the heads of simulator instructors, all things they are seeing repeatedly, but I just don't know, maybe somebody would comment afterwards, does that feed back into the management? Because that's very revealing. These are really powerful signals of what culture, work culture people have come from. And one example of that I think is notable is the work that was run at what I was going to call the Harvard Simulation Center. I was told last night I should call the Simulation Center, is the work that is very nice work that Dan Raymer, Jeff Cooper and others did, looking at monitoring and challenging behaviours, creating conditions just to see, do people speak up? Do people challenge a senior who's making some really terrible decisions? And their data, which will be reported in some earlier conference, I think were fairly horrible and horrific about how long sometimes it took. Well, that was telling them a great deal about the culture from the units that they were sampling people from for these studies. So that's the simulator is potentially a great source of safety data, which I think is untapped, but I don't work in a sim center, so maybe I'm wrong. The other thing that I wonder is, are you getting data for your simulation work from the safety managers, the safety professionals in the healthcare organizations you work for? We were struggling once years ago to come up with, we were trying to train or help with the training of offshore managers, the people who run platforms and rigs like Deepwater Horizon, where they try and train these guys for unexpected events, except they've got a pretty good idea of what the normal events are going to be. They're going to be blowout or helicopter hitting your deck or things like that. And we were working a bit with the simulator people, and they were struggling to get unexpected events when one of the managers, an oil company manager, said, but there's fantastic unexpected events in your near-miss data. The near-miss data, the incident data, have got all these glitches, horrible combinations of events that nobody ever thought would happen. They didn't necessarily cause an accident, but they could have done. And these are fantastic data for feeding into the simulations and feeding into your scenarios. And then when people say, that's ridiculous, that scenario, that could never happen, you say, it came from your own organization, it came from the incident reports, it came from the near-miss data. So there could be another feed, I think, from the safety data that organizations have, giving you things you could test and you could implement. And maybe you do that already. And my last point is really, I'll skip this slide, is really the safety culture for beginners. And that's the people beginning to work in the healthcare organizations. What we need to, I know it's so important that people do work with the professionals that are in post at the moment, but what about the new professionals, the people who will be shaping the culture in the years to come? I think if we really want to change the culture in healthcare, it's extremely important we work with the undergraduates and start to establish safe behaviours to make the right culture for healthcare as it goes through this century, teaching them about patient safety, teaching them non-technical skills, which in Aberdeen University we're beginning to do. And I've seen some nice examples of this. I was in the Skills Centre in Queensland and watched them run ward simulations with very young undergraduates, playing the roles of patients, playing the roles of doctors and nurses. And that's a fantastic way of starting to teach them and shape their behaviour early on. So I think the simulation can, I know many of you are doing this already, but the simulation in terms of changing the culture is not just for people who are in the culture, it's people who are going to be shaping the culture in the future. So that's my take on simulation and culture, simulation as a driver for culture change, and simulation potentially as a great data source to help us understand the culture better. Thank you very much for your attention.
Rhona, thank you. Thank you very much for a very inspiring talk and showing us some. Whoops. No. Rhona, thank you very much for a very inspiring talk and showing us some principles from other areas, which I think can really help to increase the value that we can create also with simulation, also showing some practical ideas. I'm sure there will be questions and comments. We have a few minutes for doing so, so please. And if you ask a question or if you make a comment, it would be nice if you identify yourself with your name and your institution, please. Richard?
My name is Richard Kyle from the Uniformed Services University in Bethesda, Maryland. And my question has to do with culture and cultural change and learning. In my mind, those are two of the same things. You can't learn you can't learn without change, and change is definitely going to learn you one way or another. Here's the question, or here's the dilemma. This comes out of slide number 4. The role, the job, the label of student and learner is not one of, it's not valued. And so when you've got folks who do everything they can to get past that point of being called the medical student or the resident or whatever form of student label, because that's not a sign of, it's not appreciated, it's not valued. And then you come along and you say, oh, all you folks, let's do teamwork training, let's go, and you've got adults who say, I don't want to go back being a student. That was a very miserable time for me. So do you have any ways to change the cultural attitude to what it means to be a student?
That's a big question, but I think some of the experience my colleagues have had, my colleague Rhona Patey, who's been working on the non-technical skills, is that students find this focus on things like team working, decision making, things they're going to have to use. They find this early focus helpful. So being a student in any field of healthcare, I think, is very demanding and a responsible kind of study period for these people. And I think some of the focus here on additional skills can actually help students and maybe smooth their way through some of that time. Their whole kind of attitude take to being students may be a bit of a bigger question.
Dan?
Dan Raymer from the Center for Medical Simulation in Boston. Rhona, excellent talk, thank you. The issue of patient safety has been around for a long time, but it seems to me to have peaked when the Institute of Medicine report came out, and in the year or two after that. In simulation circles, my sense was that patient safety sold well, that is, that money was put towards patient safety for a while. And my sense is that it's becoming harder and harder to make that case, that other priorities are taking over and that the dollars kind of expire after a while. After a major incident, so in the oil industry, you know, we have a major blowout in the Gulf of Mexico, everybody's concerned about safety, but then after a short time, people turn their heads and we kind of go back to baseline. So that's a sense, you're the expert. Is that the way safety happens in all these industries? Yeah,
it could be. There's certainly a big flurry when there's a big bang. But I think working with those industries, in some ways we're better often not talking on safety, not focusing on safety. I think what we should focus on is performance, really, because People in those kind of industries are very performance driven. They want to make a good job. They want to make targets. They want things go efficiently. They don't want their drilling rigs to blow up or the pipes to get stuck. And I think it's all the same stuff. I mean, safety is not inherently a sexy topic for for most of us, probably. And so I think if we want to look at good behaviors to do with decision making, teamwork, speaking up, whatever, I think we can couch that often in a performance productivity label. For me as a psychologist, it's all the same stuff. The job goes smoothly and things don't go wrong, or they go wrong less often. And I think when we're in certainly in the UK, going into a very chilly economic climate, then the drivers may be more around efficiency and effectiveness. And for me, if we have to wrap it up that way, but we get the same behaviors and we get less errors, I think that's what maybe the way we have to play it.
Thank you.
Jenny.
Hi, Rhona. Really enjoyed your talk, and thank you for everything you've done advancing research on behavioral skills or non-technical skills. My question is about dose. So all of us try to work with our teams on behavioral skills, and in my center we have them for 1 day. So I'm wondering what your thoughts are, either based on your research or other things you've read, about what advice you might have for us in the simulation community about whether we should be spacing learning more, whether we should be intensifying and compressing the learning. If we really want to see behavioral change over time, what should we be doing?
I don't have good data on this, but I think the aviation model, which has been developed over a number of years, is probably instructive. So their pilots do 2 to 3 days CRM, non-technical skills training, and then that's in the UK, that's reinforced every year that they will have at least a day, half a day. They'll take a given topic and they'll work on the base in their own units on those topics. So if their topic for year 2 is decision making, they'll look at their safety data, they'll look at incidents, they'll look at things that have happened, and they'll feed that into a decision making focused session. And then the next year it'll be another factor, but it keeps refreshing those skills. So it's not just one-off. It depends kind of where people are coming from in terms of their baseline, because pilots do quite a lot of this work. But I think it's not just a one-off. I think most of us need recalibrated occasionally, the psychologists included, around those kind of behaviors.
Thank you.
I would like you to thank Rhona again for this very nice talk.